superheroes. I'm Pink Phoenix, coming to you from Purdue University College of Veterinary Medicine's League of Vetihumans. Today, our special guest on Vetihumans Live is MAVEN. Thanks for being on the show, MAVEN.
Thanks for having me, Pink Phoenix.
I'm really excited about this episode. To get started, could you tell us your story?
Sure. Well, I was born and grew up in Montgomery, Alabama. I got my first dog when I was 10, and this was after years of allergy shots and very much against doctor's orders. But my parents gave in and let me get a Cocker Spaniel when I was 10. And then I attended Auburn University, where I earned both my Bachelor's of Science degree in microbiology and attended vet school. And when I graduated from vet school, I sent my pediatrician a copy of the graduation announcement and said, thanks for the allergy shot, since I was one of the least likely kids to go to vet school.
I love that. That's excellent.
And out of vet school, I did work in small animal practice for a few years. And then I had the opportunity to move to Washington State, which is a long way from Alabama. And there I enrolled in a combined program at Washington State University, where I earned my PhD. And I simultaneously served as a resident of clinical microbiology in their diagnostic lab. So that's when I first learned about diagnostic medicine. And then I came to Purdue straight out of grad school in 2013 as the head of the bacteriology section here at the Indiana Animal Disease Diagnostic Lab, which I will call the ADDL from here on out because it's shorter. And in 2019, I became the director of the lab.
That's awesome. Such a cool career path. So, MAVEN, how did you decide on your superhero name?
Well, it was pretty straightforward. So micro is short for microbiology, which is my specialty. So that was the easy part. And then I'm always looking for an opportunity to use alliteration. So when I came across the word MAVEN, one of its definitions was expert. So I thought, well, that's it. I've decided that the name has been found.
Can you tell us more about microbiology? What is that?
Well, microbiology is the study of microorganisms, or another way to think of that is organisms that you have to use a microscope to see. So bacteria, fungi, viruses, all the little tiny things. And more specifically, the ones that can cause disease are the ones I focus on.
Wow, that's really, really cool. MAVEN, can you tell us when the moment was that you knew you absolutely had to become a veterinarian? What happened?
Yes, it was the 8th grade career project. Mrs. Smith at St. James School had us select a career, interview someone in that career, and then volunteer or shadow for a certain number of hours in that career. And I selected veterinary medicine. I think I made that choice because I had a dog. I liked science. And I knew from a very young age that I did not want to wear pantyhose and high heels to work every day. So veterinary medicine seemed to be a reasonable selection. And through that project, I got to interview our dog's vet, Dr. Griffin. I got to spend time at the hospital. And while I was mostly cleaning tables and restocking drawers, I also got to observe a lot of very exciting things. And that was enough to get me hooked. And honestly, I don't think I gave serious consideration to any other careers after 8th grade. So thank you, Mrs. Smith, if you're listening.
That's awesome. So it's all about the high heels, huh?
That was a major factor in my decision, yes.
What kind of shoes are you wearing now?
Not high heels. I'm wearing lab-appropriate shoes.
Okay. That's a perfect segue here, that you're wearing lab-appropriate shoes. You run the state of Indiana's Animal Disease Diagnostic Laboratory, and you're a veterinarian, but you use your superpowers as a vetihuman to control the pandemic. How are you doing this?
Well, our lab had the very unique opportunity to play a role in testing human samples for COVID to help control the pandemic. And my superpowers include organization and communication. And so as the lab director, it's my job to make sure we have the resources we need to do the work. So the right people, the right supplies we need, the equipment, and also the right processes need to be in place. So in the case of our COVID-19 response, This required coordination among several groups outside of the ADDL. And if something wasn't working right or as efficiently as it should, it was my job to make sure the needs were communicated and solutions were reached. But the professionalism and expertise of the entire ADDL team was really what was key to the successful COVID response.
Who are all the groups you had to work with?
Well, we worked mostly with groups on campus, so the folks that would help supply the money for equipment that was needed, the folks working at the testing center so we could coordinate getting the right kind of samples and getting them to the lab in a coordinated manner. There were the data people that had to help make sure the correct data would be associated with the samples and communicated to the lab. And then beyond the samples coming into the lab, that data had to go out with our lab reports as well to make sure that the state had the current information on test results.
And you didn't just do testing for inside Purdue, right? You did some outside work as well.
Yes, we did a small amount of testing for our local hospitals, and this occurred over winter break of 2021 when our campus testing slowed down because everybody or a lot of people went home. And we had some capacity freed up. And at that time, the hospital labs were backlogged. So we were able to step in and help do some of the testing. And what that did for the local hospitals was to help the outpatient procedures to move forward because they had to pause on a lot of those because they weren't able to get test results quickly. So we were able to fill that need.
That's so wonderful how you and your team, I know you've worked super hard and you had to do a lot in a really short period of time to ramp up how much you've contributed to not only our university, but the community and the state. So thank you.
Well, you're welcome, but I think the real thanks goes to the team here doing the work in the lab.
What do you tell people when they ask why an animal disease diagnostic lab is running human samples?
It's because animal disease diagnostic labs were already set up to test large numbers of samples by PCR. And PCR is the lab test that we use to detect SARS-CoV-2 or the virus that is responsible for COVID-19. We had the equipment, we had the trained staff, we knew exactly what needed to be done, and we knew based on our experience with animal disease outbreaks that we could do the job.
What types of animal disease outbreaks have you worked on?
Well, the ADDL originally existed to control hog cholera and was a major factor in the eradication of hog cholera. Since then, the ADDL has played a major role in the eradication of pseudorabies from commercial swine populations. Even more recently, we've been involved with control of avian influenza, canine influenza, and one of the diseases we are prepared to test for if needed is African swine fever, and that's one you may have heard of in the news.
Yeah, absolutely. And back when I was in practice, I collected lots of samples for pseudorabies virus from hogs and sent them to your lab.
Great. Well, thank you for sending those samples so we could test them.
For the animal disease diagnostic lab to be able to test human samples, did you have to get special approvals or anything?
Yes, the certification that is required to test human samples is different than what is needed to test animal samples. So we were able to get that required certification fairly quickly, and that was largely due to the quality system we had in place. So in other words, we were able to demonstrate that we could do the work accurately and that we had the expertise here in the lab to perform the work. And then that led to us being certified.
What was the biggest hurdle you had to overcome in getting certified?
I think the biggest hurdle was staff qualifications because the human requirements require experience in a human lab. And even though our technicians had vast experience in the test methods from working here at the ADDL, we couldn't check the box that they had experience in a human lab. So it took about 6 months to get our entire team with the time of experience that was required for them all to have that level of certification.
Ah, that sounds like a lot of work in a short period of time.
Yes, it was. We had an excellent team to make that happen.
Speaking of a lot of work, you have a very large team of dedicated staff who were working 24/7 during the early stages of the pandemic. How did you keep everybody motivated and prevent burnout during such a challenging time?
That's such a tough question. Our team was amazing. I tried to have a consistent message of appreciation that their work was making a difference on campus and in our community. And I brought cupcakes. But honestly, I don't know how much any of those things specifically helped. Our team gave up weekends with their families to make sure tests were available in less than 24 hours. And they really just pushed through, and they are ultimately the real superheroes in this story.
You absolutely have an amazing, amazing team. Your team has tested a lot of samples. I think, isn't it somewhere over 200,000 right now?
Yes, we have tested over 200,000 human samples for COVID-19 since the pandemic started. And we've also sequenced over 600 samples.
You sequence them to see the strains, right?
Exactly. So we know what is present in our population.
So, as the head of the diagnostic lab, how has seeing the test results come in, all the numbers, the different strains of SARS-CoV-2 or the COVID-19 virus impacted your perspective of the pandemic? Has it changed your behavior personally or professionally?
I don't know if it's changed my behavior, but I will say having the front row seat watching these results unfold has solidified my decision to take the pandemic seriously, and to just as a reminder that we need to pay attention to the current state of the virus, the current numbers, the current variants, because it is changing and we need to pay attention to what's happening in our population.
Viruses are pretty incredible because they're constantly changing and we have to constantly adapt. So, a lot of us have had to give up some things to get control of the pandemic. What have you done as a family?
From the kids' perspective is they don't get to have the play dates or the sleepovers as frequently as they used to, and we're screening different families, and they're asking me a lot of questions about our vaccine status and our behavior. So it's just a whole nother layer to have those social interactions.
If you were in charge of the universe, what 3 things would you ask people to do to help get this pandemic under control?
Well, I don't have a very creative answer for you, but I would ask people to do these 3 things. I'd say first, stay home if you aren't feeling well. Second, please wear a mask when you're in public. And 3, please get vaccinated if you are able. And the reason for these 3 items is because we have data to show that these are control measures that help.
Absolutely. I think if we can all just double down on those basics and wash our hands,
Yeah, wash those hands.
We'll be all set. This has been a pretty stressful time. What's the biggest challenge you faced during the pandemic, and how are you managing it or overcoming it?
I think my biggest challenge has been loss of time with family outside of my household. I'm going to give you a few specific personal examples. The first is that my grandmother died in March of 2020, just as the world was shutting down. And my little household here in Indiana attended her funeral in Alabama virtually. And never in my wildest imagination did I ever think anything like that would ever happen. I got married during the pandemic, and we had a micro wedding with only a few people present instead of the big celebration we had anticipated. And then I had a baby during the pandemic, and so we weren't allowed any visitors at the hospital. But luckily, my room was on the first floor, so my big kids were able to come to the window and visit us through the window and get to see their new baby brother. And so through all these examples, we have found a way to adapt and move forward. And we have interesting stories now to tell the future generations.
You are absolutely a superhero. Those are lots of big life events
Yes,
to have
yes.
happened. And you did it. You made it through. What's been your best day ever as a vet so far?
it's really hard to pick one day, but I have a story that I love to tell from many years ago when I was still working at the small animal practice in South Alabama. And so I want to share that with you as my best day. Uh,
Excellent. I want to
so,
hear it.
so the clinic where I worked, but mostly my boss, we were the vets for the local zoo. And on this particular day, my boss was out of town at a conference, and the head zookeeper calls our clinic and describes a monkey who had just had a baby and wasn't acting right. So I said, Cindy, if it was a dog, I'd say she were clam sick and she needs some IV calcium. And she said, I'll be right there. And so on that day, I saved the life of a monkey.
That's so
and
cool.
That never happened again. That was an isolated event.
Well, good thing you were there for them.
Right.
That monkey thanks you. You have had such an awesome career as a veterinarian. What do you have to tell people who are listening who want to be veterinarians about all the career opportunities in veterinary medicine?
Veterinary medicine is such an interesting profession with so many options, so many different paths you can take. And I think when I did my 8th grade career project, I didn't know about all the options. I had no idea diagnostic medicine existed. So I would just say, if you're interested in being a veterinarian, explore all the options and also don't lock yourself into one. I tell the senior veterinary students this when I get them for their senior rotation with me. Even if they think they know exactly what they want to do, I say, you know what? It's okay to change your mind, because as you have experience and you try different things, you might decide you want to shift. And that's basically what I did. Small animal practice was great and had its benefits, but I think I found my home in diagnostic medicine, which is something I didn't know existed when I first started thinking about vet med.
That's excellent. Yeah, everybody out there, no matter what you want to do, try things out.
Absolutely.
That's the only way you're going to know what you love and what truly fits you. Absolutely. And then you can have cool careers like we do. Before we wrap up, what inspirational message do you have for everyone listening during this historic time?
I am an eternal optimist. So positivity and hope come really easy for me. But what I'd like your listeners to know is that we will get through this. So I cannot predict if we're going to have another wave or a worse variant just around the corner. But what we do know from the past, from science, is that pandemics do end. This will end. So I would encourage everyone to do their part and persevere and try to find the bright side as you adapt to and you overcome the challenges that you are currently facing.
That's excellent. We really do need to stay positive, work together. We've gotten this far and we are going to get through this. Pandemics do end. Thank you so much for being on the show, Micro Maven.
Thank you so much for having me, Pink Phoenix. It was a real honor to be here today.
You can learn about other League of VetaHuman superheroes at vetahumans.org. If you like this episode, please subscribe, rate, and share it with your friends. And remember, use your powers for good.